Now we start scanning the pelvis of female by using convex probe. Here we see the urinary bladder, which is partially filled but appears to be normal. Now continue scanning the pelvis. Here we see the uterus. The uterus is normal in size, no mass lesions seen. The endometrium contains a well-defined rounded cyst. It could be a gestational sac, but the patient had a history of end of menstrual cycle for last 10 days. No free fluid seen around the cyst. Now we will measure the size of this cyst. The size of this cyst is 10 into 6 millimeter. Now we continue scanning the adnexa to rule out the cause of pain. Here we see free fluid in the right adnexa. There is also a large anechoic cyst in the right adnexa. No septation present. And also we see a small cyst at the right side of this cyst. When we continue scanning the cyst, the small cyst is not attached with the large cyst but lies at right lateral side. This cyst is well defined, oval shape and thin walled. Now we will measure the volume of this cyst. The volume of this cyst is 336 milliliter. When we compressing this cyst, patient feeling no pain. So we continue scanning to rule out the cause of pain. Here we see the small cyst contain debris, but the large cyst is anechoic. Here we see the reverberation effect. Now we continue scanning the right iliac region. When we rotating the probe at its axis, the cyst become a tubular structure. Now we will measure the volume of this cyst. The tubular cyst contain volume 46 milliliter. Now we continue scanning the tubular cyst in the right iliac region. Here we see another lumen connecting with this tubular cyst. The both tubular lumens are connecting with each other. Now we scanning the origin of this lumen. This lumen is connecting with the cecum. Here we see the gases in the cecum. This is inflamed appendix and patient is feeling pain at this area. Now we will measure the size of appendix. The appendix is inflamed and its AP diameter is 14 millimeter. The normal diameter of appendix is up to 6 millimeter. This cyst is arising from the appendix. The soft tissue around the small cyst also shows increased echogenicity and inflamed. Here we see collection in the soft tissues. Now how we will write report.